The National Health Department is in the process of negotiating agreements with the private healthcare sector for extra beds for COVID-19 patients. You may recall our interview on the subject with Netcare's Jacques Duplessis yesterday. Nickolas Crisp is one of the Health Department's negotiators. He joins me now. Nickolas, good evening and thanks for your time on the Pulse tonight. Firstly, what are you saying in these negotiations to the private sector in order to get their support and buy-in?
Good evening and good evening to the viewers. I want to correct it. It's not really negotiations. It's just what we've been involved in from the National Department is setting tariffs for the procurement of services by the provinces, because it's the provincial departments of health that deliver services. And once the peak started building up in the Western Cape, it became clear that they would need to source beds outside of the public sector, and the same is going to happen in other provinces. So our objective has been to provide a mechanism for them to do that and to set the tariffs for them to do that.
How have the talks been going? Because ultimately, I imagine that you'd be trying to procure these services within the private healthcare sector at a much lower rate than what they would be currently offering.
Yes, from the outset, the private sector said to the government that they would make services available in their hospitals, and the independent practitioners would make services available at cost price. So there's never been really much of a difference of opinion on the approach. It's been trying to understand the quantification of what that cost price actually is and agreeing on the amounts in a fairly complex environment.
Are you finding that you're winning in terms of setting those tariffs?
It's been concluded, and the province, Western Cape, already has concluded their agreements with the private hospital groups, the practitioners, and all the other role players. And most of the other provinces have already embarked on or are almost concluded with deciding which hospitals they are going to sign agreements with.
What have you found are some of the concerns that are coming from the private industry, especially when entering into these agreements?
Look, the main problem is that it's a very complex environment. So the hospitals do not employ the health professionals other than nurses to work in their hospitals. So the difficulty has not been how to reach agreement. Everybody has been very cooperative and very willing to work together. The difficulty has been that there needs to be a separate agreement with the hospital, and then separate agreements with the doctors who have contracts with those hospitals to work in those hospitals. And then it's a separate pathology company and a separate X-ray department, and additional services like dialysis are also provided by different service providers. So it's not a question of just going to one private provider and saying, I would like to buy a service. It's far more complicated than that.
So effectively, for every service that is provided, there is an independent service provider for those services, and you're having to negotiate with each and every one of them.
Well, to avoid that, we've been working with groups. So, for instance, there are 4 major players amongst the hospitals, the 3 big hospital groups and then the National Hospital Network. And so we've been working with the 4 of them to get agreement on what is the cost for specific types of beds that they, across the board. Then in each of those hospitals, say for instance one hospital group has, for argument's sake, 50 hospitals, then those hospitals are spread around the country, and the practitioners who work in those hospitals all work for themselves. So we've been working with the practitioner groups to try and get agreement on what is a reasonable amount to pay per bed per day for them to provide the clinical care in the hospitals that we've signed agreements with.